I am Dr. Manishwar, ENT surgeon, Gandhal ENT and Dental Hospital, Someshwarapuram, Tumkur. In this video, I am going to explain how to give nasogastric feeding. First of all, you should know what is nasogastric tube. Nasogastric tube is a tube which we pass through the nose and to the stomach here. So it is approximately, here from here to here it is 25 centimeter, from here to here 25 centimeter. So that means approximately we should pass the tube to about 60 centimeters. So here the marking should be 60 centimeter. We should not push beyond 60 centimeter or it should not be less than 60 centimeters because we want this tube should be in the stomach. Okay, this is the first point. Second point, how to feed through nasogastric tube is basically the first thing is patient should be in the sitting position, and you make sure the patient has got a stomach empty by aspirating with a syringe. You take one empty syringe. So you just hold it like this, open the tube and try to aspirate like that, pull the contents of the stomach. So if lot of fluid is coming in the syringe, that means stomach is full of fluid or diet is there. So in that case, you avoid feeding the patient. The next is how to feed the patient with the food. So basically, we should give all liquid diet. Any liquid diet you can give. You can take a 50 ml syringe like this, connect to the tube like this, and just hold it above the patient's head like this. By gravity, the fluid will go. Before you start feeding any food, you first give water. A minimum of 30 to 50 ml of water you put it and it will pass through the tube. And then you take the food and put it into the syringe. And depending on the amount required, you can put it in the syringe and it will go through it. After the diet you give, you again put water so that the tube is kept clean. Here the most important thing is you don't give large meals at a time. Another thing is you have to give like for example small meals at frequent intervals. It may be around every 2 hours you can feed, starting from morning 6 o'clock till night 10 o'clock. So in the night time you avoid feeding with the food. Morning time you can give like a fruit juice, you can give buttermilk, milk with oil and sugar, even non-vegetarian items like boiled egg. You just put into the mixie and mix it thoroughly, blend it and filter it, and you can give. You can also give chicken soup, mutton soup, even any dish, any non-vegetarian dish, which you have to sieve it through the cloth, and it should be like the diet should be like a water. It should be like water only. If it is thicker than water, it will not pass. You have to make it very dilute so that it will pass very easily. So even for giving medicines, you can use the same tube. The how to give medicines is first you check the patient name, check the medicines, what a doctor has written, and take the medicine, and you can just put it in the same syringe and put the medicine. After putting the medicine, again you have to put little water. So for example, you want to give some tablets, then you have to crush it or dissolve in water and then put into the same syringe, and after putting the medicine you can put little water. So but for giving medications you have to take the doctor instructions. Even for giving food also doctor instructions has to be followed. If the patient is diabetic, means is suffering from diabetes mellitus, in that case you have to avoid high carbohydrate food. You have to avoid, like sugars should be less. So sugar and jaggery in any form don't use it. In a hypertensive patient, for example, patient who has got high blood pressure, you avoid salt should be restricted, or you use it less. And after you feed the patient, patient should be in the upright position for about at least for a minimum of half an hour to 45 minutes. He should not lie down fast. If he lies down, there is a chance that the diet may come to the throat and they get easily regurgitation of food. So to avoid regurgitation, make the patient to sit in the upright position. I think if you follow these rules, I think you will not have any problem. In case patient develops diarrhea, constipation, and even vomiting, it's better to consult the concerned doctor so that he will give some advice. Uh, don't continue to feed the patient. Thank you for watching this video. Please subscribe this channel and share across people who really require this information.